Dr. Crystal Nelson. Welcome to the Valder Beebe Show live in Dallas, Texas. How are you?
I am well. Thank you for having me.
Well, I get to talk with you about the research that's showing many Americans with depression and anxiety, they feel they need mental health medication treatments, and they don't feel that it's, I guess, custom to them. It's a one-size-fits-all. So let's talk about that. Why are the patients feeling like their medication is a one-size-fits-all and not personalized health care?
Well, mental health care treatment is highly individualized in general. What we know, of course, is that what works for one person just simply may not work well for another person. In 2026, the Gene Site Mental Health Monitor survey showed us that about 88% of patients diagnosed with depression and or anxiety said that they would feel more comfortable if their mental health care was more personalized. So we know that personalization really matters when we're talking about symptoms, medication responses, side effects. All of this can vary significantly from person to person. So if we're able to tailor these treatment plans, we are able to have a much more informed conversation and hopefully an overall better treatment experience.
Is that when the gene site test comes in, and does it help?
Absolutely. So we know currently the way we approach medication selections can just be a very long, frustrating trial and error process. Only about, that survey showed us that only about 13% of patients that had previously tried a medication had a good outcome with the first medication. And so we know that using a test like GeneSight, where a clinician can just simply order this in their office and do a cheek swab, and in a few days have a test that can give them results telling them how the patient's genes actually could impact the medication outcomes, making this a much more personalized approach.
And so the doctor can read this gene testing?
Yes, absolutely. So when that cheek swab is done, in a couple of days, the doctor will get a report back, which is a very simple, easy to decipher report, giving them information about that individual and how that person's genes impact the medication outcomes.
Okay, here we go. This is my anxiety question. Okay, so what
Yeah.
should we be telling our doctors? Because we think the doctors should know this.
Well, I think it's important that you are able to have a comfortable, open, and honest conversation with your doctor. And you can simply ask your doctor to order the GeneSight test for you if they've not done so. You can also go to genesight.com and find a clinician that may offer this test. But if you have a great, trusting relationship with your doctor, having that collaborative conversation is always something that should be comfortable and easy to do.
It should be, but I have you professionals all the time. You tell me that, but I always think about the person who's a little bit older and may not have anyone to speak for them, or the person who's afraid to speak up, or the person who just is not following the current trends and don't know. They get lost in the system and no one's speaking for them. So if you don't know to ask, how do you get this?
Absolutely. I love your question. My heart is with geriatric patients. That's the primary patient that I see who doesn't always have that person speaking for them. So, if that is the case, there is always the opportunity to go to the genesight.com website and find a provider that is offering this test. So, if that is not something that you're comfortable doing with your current healthcare provider, you can always locate a provider who's already comfortable using this.
I want my audience to know today I'm speaking with Dr. Crystal Nelson. She's a highly esteemed board certified psychiatrist and a published author and very well known in her field. Is there any other information you would like to leave the listener with today?
Well, I would just like to close with, this is Mental Health Awareness Month. If anyone is dealing with mental health issues in silence, please reach out to your healthcare provider or visit genesight.com, where you can find a clinician that can be comfortable addressing all your needs and creating a personalized treatment plan for you.
Dr. Crystal Nelson, this information and this conversation has been so valuable. I want to thank you for taking the time to be my guest on the Valder Beebe Show.
Thank you for having me.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/Valder Beebe Show. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/Valder Beebe Show and stay connected as I interview the world's most fascinating people.